We're set? We're rolling?
You are.
All right. My man Derek, good to see you again.
Good to see you too.
We're just having a little conversation.
All right, good. I don't know what I'm looking at. Good.
So I think it's been at least a year, maybe 2 years since I've adjusted you.
Right.
And what was it that brought you into the office at that point?
Just sciatic pain.
Sciatic pain?
Yeah.
Just sciatic pain?
It was just that one from what I can remember.
How long have you been dealing with the sciatica for?
Probably like maybe, 5 to 7 years maybe.
And do you remember, was there an initial onset where it began for you?
I don't know. People said that maybe when I got into a car accident when I was like, maybe when I was like 20, 21, that maybe that could have been like the reason for it, and just like I didn't feel it at the time, and it kind of like surfaced later. So yeah,
that's a really important lesson when it comes to car accidents.
Right.
Is that people come in here all the time and they're like, "Oh no, I was fine." I'm like, "Well, what happened to your car?" And they're like, "Oh, the car was totaled." Like, well, if all that metal in the car bent, do you think your body absorbed that force? And they go, "Well, yeah, probably." But the way it works in our body is that after an accident like that, the tissues are still healing for 6 to 12 months after. So someone can get into a car accident, they walk away, they're like, "I feel fine." And then 8 months later, they wake up and their neck is stiff. Or maybe their mid-back is stiff, or whatever is happening. And what they're not aware of is that that accident is what began it. And as our body is healing, what we do is we go into our regular habits, whether it be lifting heavy weights, sitting at our desk not properly, or looking down our phone, and our body heals that way. So I would say it definitely plays a factor, especially if it's a big accident. But the biggest key with it too is what are the things that we're doing on a daily basis. So for you, is it currently a desk job? Are you moving around? Desk job.
But I do get a standing desk, so that helps out a lot. Yeah.
Awesome.
Yeah.
And how often do you feel the sciatica at this point?
It probably comes like maybe around like once a month.
Once a month.
Yeah.
And when it does, is it a shooting pain, a numbness?
It's just the dull pain. It's not like the excruciating pain like it used to be. It's just like the dull pain.
The dull pain.
Yeah.
Okay. Awesome. Well, let's see how things are feeling for you now. Because has it been that long since the last adjustment?
Yeah, it's been a while. Yeah.
All right. This is gonna be exciting. Let's go get your face down, my man.
Appreciate it.
Just big deep breaths in and out. And make sure we get these awesome avocado socks on camera right here. These are by far the best socks that we have seen all day. Amazing. So as always, we want to notice what we notice. And what I notice with Derek here as he's laying there, there's some rotation right there at his pelvis. I can tell there's a slight rounding occurring here. And even with the legs, it appears that there's a slight difference here. Let's see what's happening. Trailing off just the tiniest difference between the right and the left. And it's oftentimes it's not how much something weighs, but how long you end up holding it for. So even if your legs are off slightly, if it's like that for a long time, it can create imbalances that go throughout the entire body. Cool. So Derek, what I'm gonna do here is take your body a few different ranges of motion. So right is still slightly short here in the second position. And when I bring my heels to your buttocks here, is there any pain or discomfort with that motion for you?
No, not really.
Perfect. So what we're going to take a look at with him is how well things are moving. And what I'm noticing right off the bat here is that there's restriction, i.e. a lack of movement in his lower right side and upper left. So Derek, what I'm going to do here, I'm going to place my hand on your sacrum. You're going to keep your leg as straight as possible, and then you're going to lift one leg up as high as you can.
Doesn't matter which one?
Doesn't matter which one. Just lift one up, and then back down. The other side, and then back down. What did you notice with that?
Well, this one obviously feels a little bit more not as comfortable as this one.
So the left side for him, as he's lifting his legs up, does not feel as comfortable as the right side. And with both of them, we have a lack of motion. And what we want to see is those hips move, because we don't want this area to be restricted. You want to be able to move it as freely. That means the muscles are engaging, that we have less tension. So let's see what's happening here, my man, okay? So first and foremost, what I'm noticing is that restriction throughout the sacrum. And as we go into his lumbar spine, the muscles of his lumbar spine are very tight and they're very tense. So Derek, if I poke in right there or there, what is it that you notice?
That side's more tender from what you just did right there.
The left side's more tender?
Right.
Okay. So these are all such great indicators of what's happening with Mr. Derek here. And what I'm noticing is right here at the level of L5, He's going to have tenderness on the left side. L5 is not moving, so that segment is restricted. And we want motion in there, because if you don't have motion in your spine, you increase the likelihood of it wearing out, getting degeneration, i.e. arthritis. And every time you have motion, you get synovial fluid, you get blood in there, the area gets lubricated, and you decrease the likelihood of wearing it out. And that's why getting adjusted is so important. That's why it's really important to move afterwards as well. So what we're going to address here is, number one, we're going to take care of this L5 on you. So you're going to have this side up facing me. Straighten that bottom leg. Perfect. Make sure we get the socks. We got the socks.
Nice.
I love this. I love these socks. True story. I didn't even know what an avocado was until I moved to California.
Yeah, come on.
Roll that over. Breathe it up. Breathe it up. Wow. That was a huge movement. Other side, my man. So what we did there is we got an incredible motion at the level of L5, and up next we're gonna go ahead and take care of that. Grab that right there for me. And you're gonna let you relax right there. Perfect. Up next we're gonna take care of is this sacrum on this left side. I'm gonna adjust it from the right side. And what's happening is there's rotation on that sacrum. You're gonna just breathe out all the way for me. Breathe it out, breathe it out. Perfect. Wow. That moved real well. Go face down for me. How you doing, Derek?
Outstanding.
Outstanding, he says. Perfectly even in that first position. Almost perfectly even in that second position. This is looking a lot more balanced for him. And now as I press into this left side, it moves a lot better. Derek, I'm gonna poke in pretty hard into that L5 area again. What's the tenderness like for you right now?
It's okay.
It's okay?
Yeah.
Still persisting?
Yeah.
Cool. So definitely the area is moving better. That tenderness is still persisting. Most likely because the muscles have been overworked. They're tight and they're tense. Cool. So let's go ahead and retest you lifting the leg up. So do one leg at a time. And then the other side. Awesome. What did you notice?
It was a lot easier.
It was a lot easier, he says. And you could tell he was able to lift his legs up a lot higher.
All right.
Amazing job, my man.
Thank you, sir.
What we're gonna focus on next is gonna be this midsection here.
Okay.
And what you're gonna notice is that there's a tendency for it to round a bit. And what happens is if we do have a desk job, it's a lot easier for folks to lean forward a bit and be more comfortable in that position as opposed to sitting upright like this all day. So what I noticed with Derek here is that right around T10, T11 here, lots of restriction and tension, tightness. The nerves that exit out of here are going to deal with your digestion. So if you're having any issues with digestion, opening up your mid-thoracic spine certainly can help. What I want you to do, Derek, is you're going to bend both knees for me right there.
Okay.
You're going to go ahead and take a big, big deep breath in. And you're going to let it all the way out, all the way out. Perfect. Let that relax. Big deep breath in, all the way out. One more time. All the way out. Perfect. Flip on your back for me. So we open up T10 there, and we're going to go put a little bit more oomph into this upper thoracic spine. So you're going to bend this knee for me here. We're going to go big hug this way. Take a big deep breath in for me. And right there, you're going to let it out. Oh my goodness. Breathe out, breathe out, breathe out. Perfect. One more, just a little bit below that. Breathe it out, breathe it out. Perfect. Awesome. How's the neck been feeling for you?
It's okay. Not
You
amazing.
feel tension and tightness throughout?
Sometimes, yeah.
Yeah. So what I'm feeling on Derek here is that on his right side, from up here, from our occiput all the way down, there's tension that's building on that right side. So we're gonna just stretch that out just a bit here. You're just gonna let that relax. Let it relax. Let it relax right here as well. Beautiful. Cool. And what we're going to open up first and foremost, is gonna be lower down here, right around C2. Just below that atlas. Let that relax for me. Lots of tension building up for Derek. All the way relax. Let it relax. There you go. Good job. Let this one fall asleep here. Lift your chin just a little. Perfect. Now breathe all the way out for me. Woo! Bonus one. Derek, what we're gonna do here as well is do a little leg pull on you. Balance everything out for you. And then one more right there. And sit on up for me. Swing the legs on over that way. How's the body feeling?
Better.
Awesome.
Yeah.
So here's what I noticed on you is that a lot of low back tightness. So I think the key for us is to get up, move from that desk as much as you can.
Okay.
And if we can break the day up, you know, every 15, 20 minutes just to get up.
Cool.
The other thing I noticed right here is a lot of tightness in the mid back as well. So what happens is, the tendency is for us to round like this. What we want to do is do the opposite in the day.
Right.
So if you get an opportunity to put a pillow here or a towel in your upper back and you just lie back, I recommend my practice members to, you know, the ones that have been advancing through care, they can even start putting a foam roller or a yoga block there to do heart openers. So if that feels comfortable, start off with that. You can do a minute or two to open it up. And what we want to focus on is just being open like this, where the chest goes forward, shoulders go back, and the head goes back, so we can unwind the stress of sitting. But aside from that, man, great to see you, brother.
Thank you, sir.
Awesome adjustment.
Thanks, Dr. Bo.
Thank you, folks.